Hello everyone, my name is Conrad Michael and I'm a nursing student at the Adventist University of Indonesia. In this video, I want to talk about a lifestyle management to prevent asthma symptoms, so stick around with me until the end of the video. So let's talk about the definition of the asthma itself. So what is asthma? Asthma is a chronic lung disorder that causes the airways to become inflamed, which means that they swell and produce lots of thick mucus. So, for example, this is your airways. Your airways are tubes that carry air in and out of your lungs. This airway is called a normal airway. This is your airway when you have asthma. The airway becomes inflamed, swell, and produce lots of thick mucus. The muscles surrounding the airways also tend to tighten, which make the already clogged airway even narrower. In this condition, this airway is called asthmatic airway. Many things can cause asthma, including pet danger, stress, certain medication, dust, chemical and perfumes, air pollutant, smoking, genetic, respiratory infection, some food and beverages. And if you're exposed to these certain triggers, it could cause you having an asthma attack. This airway condition is called asthmatic airway during attack. During an asthma attack, also called an asthma exacerbation, the airways become swollen and inflamed. The muscles around it contract and the airways produce extra mucus, causing the breathing or bronchial tubes to narrow. During an attack, you may experience cough, wheeze, and trouble breathing. The situation can be worsened quickly, especially without prompt medical intervention, which is why a severe asthma attack is regarded as a medical emergency. In terms of how many people die from asthma, statistics show that about 3 people every day will suffer an asthma attack death. There's no cure for asthma, but there are methods that you can do to keep your asthma in control and prevent an attack. Now I'm going to explain the lifestyle management to prevent asthma symptoms. As we already see before, there are certain triggers that cause the asthma. By knowing the allergen, you can take action to avoid them and prevent your airways from becoming inflamed and swollen. In this case, you must be thinking, how do I identify my possible asthma triggers? So a trigger is anything that can lead to an asthma attack when you're around something that triggers your symptoms. Keep track of it. This can help you to find pattern in what trigger is your symptoms. Record trigger in your asthma diary or in your asthma action plan. Another method to identify your trigger is by going to the healthcare and have a skin test to know your allergy. In most cases, triggers are found in the airway breath. House dust contains a potent mixture of dirt and allergen, from dust mites and mold to animal dander and insects. This thing is considered as a trigger that causes asthma. A normal cleaning procedures often cannot remove these tiny particles. Therefore, you need to have a strategy. Prioritize the furniture and other things, especially in your bedroom, that may contain dust and other allergens, and then clean it. For example, use a vacuum cleaner, seal cracks, or other possible entryways for mold. As the summary of this method, a clean environment can help you prevent the asthma triggers. The next method is avoiding smoke. Smoking can be a trigger for asthma and make the symptom worse. If you are a smoker, you may need to quit it now, for your own good and to prevent the asthma triggers. Other sources of smoke can also trigger asthma, such as wood stoves and campfires. The next method is exercising. Regular physical activity can decrease asthma symptoms by improving your lung health. It also helps you to lose your weight. Weight loss may improve control in people who are overweight or obese. Exercises that you may perform is low-impact exercise such as swimming, cycling, hiking, and many other things. High-impact exercise is not recommended for people with asthma. For example of high-impact exercise include running, jumping jacks, some form of step aerobic, racquetball, and plyometrics, as it may cause another asthma symptoms. The next method is to maintain your dietary. You may be wondering, is there any connection between the food that you ate and your asthma? According to the American Thoracic Society, or ATS, report notes that obesity is a major risk factor for developing asthma. In addition, asthma in people who are obese may be more severe and more difficult to treat. Eating a balanced diet and maintaining a healthy weight may make it easier to manage your condition. The foods that are recommended for you and you can add to your diet include vitamin D-rich foods such as milk and eggs, beta-carotene-rich vegetables such as carrots and leafy green, magnesium-rich foods such as spinach and pumpkin seeds. This is the end of the video. I hope it will give you more knowledge. And I really appreciate if you like the video and click the subscribe button and also share this information to your friends or family. Thank you for watching. I'll see you in the next video. Stay safe.